Hi, welcome to another episode of EMDR with Alice. Today, we're going to talk about future templates and when to use future templates, how they can be used, and how powerful they can be. So, future templates is bringing in that third prong of EMDR. So, remember, we have three prongs: past, present, and future that are utilized in the EMDR therapies. So for future template, we're thinking about what do we want to do, or how do they want to respond differently in the future. So typically future templates are done at the end of treatment when they've kind of they've finished all of their target memories, completed those target memories, and then we move on to future templates where they see themselves kind of responding to triggers in the future in a different way. But future templates are a standalone protocol, and so they can actually be used in different stages of the treatment process. One way that I like to use future templates, especially in phase 2 prep for complex trauma, is when you have a client who maybe you're teaching some tools and resources, but they're not utilizing them in between sessions. It's almost like they leave the session and they don't ever think about it again. Future templates can come in handy here. You can do a future template in a session where you're having the client kind of imagine a present trigger happening over the next week and seeing themselves use the tool that you've developed in your session and seeing it work effectively. And so doing that future template in your phase 2 of kind of prepping them for triggers that might happen during the week and seeing themselves use their tools and resources that you're developing in session to help with that trigger. So that's a way that you can use future template in your phase 2 in your prep. I also like to use future templates around the holiday time of the year, especially when clients are going to be around their family. Who can be very triggering for them. And so especially if you have clients that are kind of dreading the holidays or dreading being around family, or they know in particular that they're likely to get triggered and they may get pulled into some of those old patterns of behaving and relating with their family members, future templates can be very powerful for helping set up family interactions in a successful way. And so what I like to do is just let's talk through what are some typical patterns that you get into with some of your family members over the holidays? What's something that typically would happen? What's a typical response you find yourself getting into? And then what we do is we begin to kind of construct an idea of how they can handle it differently based on the things that we've learned in therapy. Like, where do they have choices now? What are some of those choices? What are their boundaries now? And how can they assert those boundaries? So we talk through some of that stuff. And then we do create a future template where they see themselves following through and utilizing the tools that they've learned in therapy in those family interactions. The beautiful thing about future template is once you've created the future template, then you start working on challenges. And so you and the client can then talk through, okay, so what if you assert that boundary and then mom doesn't follow through, right? She still does her thing. What do you want to see yourself doing in response to that? Or how do you want to see yourself handling that in that interaction? And so you create that challenge, and then you do another kind of template around that challenge point. And you can do as many challenges as you have time for in that session, just thinking through and predicting all the things that could potentially go wrong in that family time around the holidays. And so it's a great way to prep clients for those and help them feel more successful and more empowered going into those interactions. I often get clients come back and they give feedback like, this was the first holiday where I didn't, lose my mind, or I didn't go off on somebody, or so-and-so did what they, Uncle Harry does what he always does, but I didn't feel like I got all worked up about it like I usually do. And so I was able to actually enjoy myself. Or I've had some clients say, so dad started in and I said, I don't have to listen to this and I'm going to go for a drive. And so they use that choice instead of staying frozen and listening and kind of being hijacked by their dad and the diatribe that they may go through. So creating those future templates creates opportunities for choice, creates opportunities for maybe some assertiveness or whatever might be needed, boundaries, when they're interacting with their family. And so it prepares, again, clients for those interactions. You can also do future templates anytime in the treatment process, meaning you could be doing some processing and memory work, but something comes up in their life that they kind of need some prep for to be able to interact. So a perfect example might be if you're working with a client around court cases and they're going to be testifying soon. And so we may pause our treatment and do future template work in preparation for that court date. Same thing maybe for a job interview that a client might be having. I did one with a client one time who was getting ready to try out for a major league sport, and they were really kind of off of their game lately. And so we did some future template work around performance improvement, and they were able to actually go and have a successful tryout. And so there's different things that you can use future template for, but again, it's all kind of in the vein of prepping clients for something in the future. In the treatment process, when it falls along the end of treatment, it's when we are helping clients see themselves respond in a different way than they ever have before to those triggers. And so it goes really nicely at the end of treatment as well. So future templates are very helpful, very important. They're a very powerful piece of the EMDR puzzle, and I highly recommend doing them if you can find time and space to do them in your treatment. Thanks for joining me today, and we look forward to talking to you next time.